Hi, I'm Helen from SBI4U Miss Lauren class. Today I will be presenting about in vitro fertilization IVF, which is one of the techniques used in biotechnology today. We'll be also discussing about bioethics in this presentation as well. So let's jump right into our presentation. So this is our today's agenda. First, we'll be looking at the history of IVF. After that, we will also look at the process of IVF. I will also share you the kind of pros and cons if we go through IVF. Moving on to the next part, we'll also look at legal issues, ethical controversy, environmental issues, and social controversy of IVF as well. After that, we will also look at the government regulations and regulatory bodies that are in use for IVF. Last but not least, I will also share you my personal opinion and personal point of view for IVF, and I will also give you the references that I use in my presentation. So what is IVF? IVF means in vitro fertilization, which is an assisted reproductive technology, ART. So IVF is right now the major technique to resolve infertility problems. Now let's look at the brief process of IVF. So if you are not really familiar with medical terms, IVF means the removal of egg from the woman's ovaries and fertilizing it with sperm in the laboratory. After that, the embryo is put back into the woman's uterus. So to look at it in more details, in IVF, we aspirate oocyte from follicles before ovulation. This is usually at the metaphase 2 stage of meiosis, which is later followed by fertilization in vitro with spermatozoa from ejaculated sperm or surgically extracted in severely oligospermic man. Oligospermic means that there is a deficiency of sperm. Later, we have to wait for a few days for the embryos to reach the morula and blastocyst. So here you can also see that this is the morula and blastocyst stages. These are the early stages of becoming an embryo. After that, we transfer the embryo into the uterus. Okay, now we'll be moving on to the history of IVF. So IVF became possible as a treatment for infertility problems in 1960s and 70s. And the first IVF baby was born in England in 1978. Later, more IVF babies are born in United States as well. And since that time, IVF has continued to evolve with different procedures. Today, 1 to 3% of all births percentage come from IVF each year. Now we'll be looking at IVF's process in specific details. So IVF's process in the past and today. So we have been using various medical procedures in IVF, but they all are based on one concept. So in IVF, using injectable medications to stimulate follicles to yield oocytes at retrieval is the common concept. So the first IVF baby was born in England in 1978, as I also mentioned earlier. In this case, the mother had a natural menstrual cycle, and oocyte from the ovary is retrieved, which is followed by fertilization in vitro later. After that, a cell embryo is transferred into the uterus. So this is the first process of IVF in 1978. Next, let's look at the first IVF baby born in US in 1981. In this case, the mother was injected with human menopausal gonadotropin for several days. This is with the intention to induce several follicles to produce oocytes, and later on these are also retrieved, which is then followed by the same procedure, fertilization in vitro, and later on we have to wait for a few days, and then these embryos, especially day 3 to 5 embryos, which are also considered as the healthiest embryos, are transferred into the mother uterus. So what about the IVF process today? So this is the five major steps in IVF. But here, if we look at it in specific details, there are altogether 6 steps. So today, IVF treatments usually involve ovarian stimulation, as I have also explained in the earlier slides. So in step 1, the mother has to suppress the natural menstrual cycle with medication for about 2 weeks, but it also depends on the age of mother and other factors as well. In step 2, the mother had to take follicle stimulation hormones, FSH, to produce more eggs for greater chance of embryos. In step 3, the patient has to go through vaginal ultrasound scans to monitor the process, and after that, she had to take the injection of chorionic gonadotropin (HCG) to mature the eggs. After that, step 4 is the collection of eggs. With the needle pass through the vagina into each ovary. Later, we have to fertilize the eggs with partners or donor sperms and grow within 6 days in the laboratory. And the last step is choosing the best eggs, and the embryos are transferred into the mother uterus using catheter. And you can also see it here. But the numbers of embryos usually depends on the mother age as well. And this is a really great YouTube video to see how IVF works. So now that we know the process of IVF, what about the cost of IVF? So the cost of IVF varies among countries. Different countries have different costs for IVF. For example, the average cost per IVF cycle in US is over USD $90,000. Now, you might be probably wondering, what could be the pros and cons of IVF? So let's look at pros of IVF first. So IVF is a way to overcome infertility for both men and women because it involves retrieval of eggs and sperms, or you can also use the donor eggs and sperm. And today, use of donor sperms and oocyte is becoming really common. So if you have any kind of infertility problems, and if you can have children in any way, then you can use the donor sperm or oocyte to have your child. And the next pro is that you can also select the perfect time to get pregnant or to have a child, because you can fertilize any eggs and sperm that were previously cryopreserved. So IVF is mainly for people with infertility problems, but people also want to go through IVF for several reasons. For example, if we take IVF, then our embryos can be genetically tested to decrease transmission of single gene mutation associated with morbidity. And also, women who are unable to carry a pregnancy are now able to use gestational carriers as well. So these are the pros of IVF. So what about the cons of IVF? So in IVF, there is a possibility that many oocytes fail to fertilize. There is also a chance of poor quality embryos and the cells with abnormal numbers of chromosomes. The mother can also end up with multiple births, such as twins or triplets. And the mother can also have to go through an ectopic pregnancy, which means that the embryo implants in the fallopian tube here rather than in the womb. And the mother sometimes had to deal with side effects from medicines used in the treatments too. And there is also a chance that the mother can have ovarian hyperstimulation syndrome, OHSS, which means that the ovaries overreact due to the medicines used in IVF. So these are the cons of IVF. And as IVF become more popular each day, it is also becoming more controversial to think whether it is ethical, along with many social, legal, and environmental controversy rising. So let's talk about these controversies as well. So first, ethical controversy. Here we have three main parts: surrogacy, egg sharing, and reproductive autonomy. Relating with surrogacy, people are now talking about IVF being an exploitation of women and human dignity. It can also have medical risks for both mother and the child, and whether it can assure the long-term well-being of surrogate mothers, children, and families. And with egg sharing, in some countries like UK, women donated their eggs. In return, they get free or discounted treatments. So there is ethical controversies, such as women should not be put under pressure indirectly or even directly to share her eggs. So the next one is reproductive autonomy. So there is one procedure called cryopreservation in IVF, which means that you can cryopreserve your egg or sperm for future use when you want to get pregnant or when you want to get a child. So there is a risk of eggs retrieval, risk of failure, and many other side effects, which can have on the mother or the child. And a truly informed consent is needed here. So these are the three ethical controversies arising in IVF. So now let's look at social controversies. Here we have two parts. The first part is casual attitudes and casual factors. In Scandinavia, for example, the use of ART is really high, and in public eyes, ART is really seen as justified and good for them. Even the government is the main part in making services available for singles and LGBTQ groups. But in countries like Italy, the Catholic Church is openly against ART. So the next controversy arises on the right of children and women. So the right of children to be brought up under safe conditions and women reproductive autonomy. Because even today, there are still many cases that fail for the women that go through IVF. On the other hand, IVF cannot also really assure on the health of mother and child. For example, the babies can be born with genetic disorder, disability, Down syndrome. They could be born prematurely or with low birth weight. And also they could be ended up with life-threatening complications, for example, newborn respiratory distress syndrome, NRDS, or long-term disability, such as cerebral palsy. So these are the social controversy related to IVF. Now we'll be looking at legal controversy. So the legal issues of IVF is the use of stored gametes and embryos after the person dies. And this is not allowed by law in some countries, even if the person that is about to die leave the written consent. But practices vary from countries to countries and clinics to clinics, especially in the USA, because some are using the stored gametes and embryos even after the person dies. So here the legal situation is very unclear and new laws are needed. The next legal controversy is the legislation for IVF singles and same-sex couples. According to 2014 survey among 28 European countries, IVF for single women was permitted in 11 countries, not permitted in the next 11 countries, and it is even undefined in the remaining 6 countries. And for the same-sex couples, there is even no specific legislation, but it could be considered as IVF for single women also cover for female same-sex couples. So the 2013 statements by Ethics Committee, the American Society for Reproductive Medicine called for programs providing IVF and other fertility services to treat all requests for assisted reproduction equally without regard to marital partner status, or sexual orientations. So these are the legal controversies. Now, let's look at an environmental controversy. So environmental controversy arises on overpopulation and greenhouse gas emission. So 1.5% to 5.9% of all children in developed countries are born through IVF. For greenhouse gas emission, out of 4.4% of global net emissions by healthcare, 0.5% come from equipment and technology related to IVF. So these are the environmental controversy risings with IVF. So now we'll be moving on to the next part of our presentation, regulations and regulatory bodies in place for assisted human reproduction, because IVF falls under ART. So rules and regulations varies on different countries, and I will be giving two examples here for ART. In US, They have several different acts for ART. For example, the Occupational Safety and Hazard Acts regulate rules and regulation for ART practitioners. It is stated that ex-donor must be anonymous. The mother who wishes to have a child must be under 45 years. An ART practitioner must be certified by the American Board of Obstetrics and Gynecology. And in Canada, no one is allowed to buy or obtain donated sperm or ovum from the person who is under 18. And informed consent must be given before undergoing any kind of ART. And the mother who wishes to have a child must be under 43 years, whereas in US it is 45 years. Children's health and well-being must be prioritized. They also have they also have CFIA and CEPA. So CFIA is to inspect and monitor imported products of biotechnology, and for CEPA, they decide whether new biotechnology products must be manufactured or imported into the country. Okay, so these are the regulations and regulatory bodies in place for assisted human regulation, which also include IVF. You can also take a look at this. So this is the IVF and surrogacy regulation in Asia. So in Brunei, Cambodia, and Myanmar, they have no specific laws or regulations. But here, if we looked at Singapore, they even have private hospitals and medical clinics acts. They have the licensing terms and conditions on assisted reproduction services since 2020. In Thailand, they have some kinds of acts, and they have the protection of a child born by medically assisted reproduction technology act. Now I'll be sharing you my personal opinion on IVF. It is true that IVF has many ethical, legal, and social controversy rising. But we human race, we always come up with new ideas, new technologies, new treatments for ourselves, and we have always overcome any obstacles by upgrading more, by working on the process and progress more. So I believe that with proper regulations and regulatory bodies for IVF in every country, I believe that IVF can really lead us and open new doors for us, apart from just solving infertility problems. And I believe that it can also become a new future to give more new treatments for the babies and for the kids in the future. So my final thought is that I think IVF is a really great technique in biotechnology, and that I think we should use IVF today and even in the future, and that I do think we should give a place for IVF in our community. So these are my final thoughts and a personal opinion on IVF. And these are the references that I use for my presentation. So this is the end of my presentation, and thank you for listening. And I hope you got something nice and useful in return from my presentation. Thank you. Bye-bye.